which as counties we will endeavor to disseminate the information correctly. The role of medical personnel will be very, very critical because this is fairly scientific. And we are also aware that there is going to be a lot of information from the social media that can mislead the public and give the false information, and sometimes allege of finding solutions to the problem. So dissemination of correct information remain paramount, and the counties using their medical department will go out of the way. So we urge the public to use the correct channels as much as possible so that they are not misled in the fight of this pandemic. By individuals protecting themselves, their families, it will go a long way to protect our counties, our country, and contribute to the well-being of our world. And so we are here as governors to participate in disseminating this information and in playing a critical role to make sure that we are safe as individuals, our communities are safe, our country is safe, and our world is safe.
We are at a very, very critical stage as a country. It's important that we see what happens going forward, and we must, as a country, align ourselves with the guidelines of the Ministry of Health. Thirdly, and more importantly, what the chairman has mentioned, is that we're asking the national government to decentralize the testing, because one of the biggest problems we have seen across the world is that unless we are able to test many people as we can, we will not manage this virus. So
tuko tayari, kwa mfano Machakos, tuko na lab, tuko na all the equipment ready ya kutest coronavirus. Tunangojea tu tukue accredited, tukue approved, and it is the same with other counties. Tuko tayari, we can start testing coronavirus tomorrow. Tunataka ingine ikue western, ingine ikue north, south. We cannot bring everything to Nairobi.
An enemy that does not know any borders of any country or any county. That is why we need to work together with all our counties to ensure that we are able to confront this disease. It will take all of us working together, and I want to thank the governors. Many of them have already set up emergency centers in their level 4 and level 5 hospitals in all the counties across the country. This is very necessary in terms of preparedness to confront this, because it can happen anywhere, in any region in our country, in any county. In the US today, we're being told almost all the 50 states are affected. So all our 47 counties must be alert, we must all be vigilant, and we must all work together to ensure that we contain this disease.